Ross says, what are the options for premenopausal women on oestrogen-blocking therapy, like tamoxifen for breast cancer, which causes menopause-like symptoms?
Oh, yeah, this is another big area that I think will change eventually. You have to look at the risk for that woman. So you can technically put somebody on HRT, but you have to be cautious as well, obviously. So if she doesn't mind, so I've got friends that have decided to stay on their HRT, even being treated for breast cancer, because they feel that their ever so slight percentage chance of it coming back is not worth the menopausal symptoms that they're suffering from. But then you'll have somebody else that perhaps has got 2-3 children and they want to be around for as long as they possibly can, and that tiny risk is too much for them. So then you have to look at what are the non-hormonal routes that we can take. So the British Menopause Society have got a really good patient-facing website called the Women's Health Concern, and it's actually really helpful for professionals as well. And there's a load of fact sheets on there, and one of them is about complementary therapies, and it even goes into complementary therapies for women that have had breast cancer. So you might be looking, if it's hot flushes that are the issue, you're looking at things like gabapentin, for example, venlafaxine. These are common painkillers, antidepressants that we might use that have got some evidence to suggest that it would help. Clonidine is a licensed medication that we can give for hot flushes. And there's even a new one that's come out called Veoza, I believe is the brand name. It's not available on the NHS, it's only available privately. It is coming on the NHS though. And it targets the area of the brain that actually is affecting your temperature control. It hasn't been tested on women that have had breast cancer, but it's got no hormones in it. So I don't see why you couldn't perhaps have that one.
Right.
And then you have to look at what other symptoms are going on. So if it's not hot flushes, which is the one that I've already said is not the only symptom, if it's vaginal dryness, there's moisturisers, lubricants, and actually we do now know that women can have vaginal estrogen safely on things like tamoxifen because it's not systemically absorbed, or at least if it is, the tamoxifen is rendering it useless anyway. So you can actually use vaginal estrogens very successfully for women that have been going through that. I have seen consultants as well that have prescribed things like testosterone for women that have got libido issues. Again, there's not really the evidence around it, so you can't really say one way or the other. And usually we give it with estrogen, so it's a bit of an unusual way to give it. It's possible, it's just that the person in front of you has to be aware that the evidence is not there yet. We haven't got that. But it's doable.